And one thing that I've heard everywhere I've gone are people's stories about healthcare. And I know you shared some of those stories tonight. I'm going to listen to those stories from the staff, but these stories have been the stories that I've used when I've gone to the Senate floor to talk about healthcare. I don't have to go and give a long-winded speech about policy. What I share are the stories of people that we've heard from in these town hall meetings or have come to visit me in Washington. But the other thing is we need to do a much better job of enrolling children in SCHIP today. Because even up to the we're not enrolling everybody we should be enrolling. And this is another piece of legislation that I introduced some time ago to make sure that our school-based health clinics, which are so important to reaching kids and families across our state, can cut through all the red tape that's preventing them from efficiently and effectively signing kids up for SCHIP as a way of trying to increase the number of children.
And then lastly for me, would you support reform that increases provider payments so that all children and families, especially those in both rural and urban areas, have access to doctors and other healthcare providers?
Yes, and believe it or not, this is another bill that I've introduced, so this is I love continuing my relationship with Mom. Yes, because here's the issue here. This can't just be about coverage. Okay, this is also about access. And if we have incentives that don't for any good policy reason lead to diminishing people's access, that's a bad thing. So the bill that I've introduced actually, which was passed actually, this is the first amendment that I passed, is on the budget, seeks to equalize the differential between Medicare and Medicaid reimbursements in rural areas with the reimbursement in urban areas. And the reason for that is to make sure that we have medical professionals in our rural communities from whom people can get medical care. So this access question is very important. I look forward to working with you going forward.
And President Obama and many other people have proposed having a private option be part of the insurance exchange.
Oh my God!
Having a public option be part of the there is a lot of support here, in addition to, right here in this room, in addition to recent polls, because a lot of people believe that a public option is essential in order to provide people a choice of having...
Senator, the people want a single payer.
Excuse me.
Introduce a bill for single payer in the Senate. Will you introduce a bill? Sir, I'm sorry. I was late as it was, but I apologize for that. I feel terrible about it. People have worked very hard to organize this. I'd be happy to talk to you afterwards or whatever, but if we can just get through the program, that was planned.
Right. Excuse me, sir. You can talk with the senator at a later time. No, everyone does not.
Excuse me.
We have an agreed agenda.
What color? I appreciate your perspective. Can we? 60 people die a day.
Please.
From not having health care.
Please sit down.
We want less warfare and more health care. We want less warfare and more health care.
Excuse me, let me ask everybody else in the room.
Please tell us about your health care.
Do you think that we should respect the agenda that we have put forward? Will you please take your seat?
Senator won't discuss it.
I believe the people have spoken.
Thank you.
Thank you.
Single payer.
Shut up.
Less warfare, more health care.
Shame.
All right.
60 people
I think everybody in this room has the same goal of affordable health care, quality health care for everyone. We may have some different ideas about how we get there, and we will stick with the agenda. And Senator Bennett, if you could address the issue briefly of your ideas about public option.
Sure, thank you. And I think you just said something very important, so I want to repeat it, which is that it's the goals that matter here. And the goals that all the people in this room share, people all across the state share, to get these costs under control, cover people, to make sure that we're focused on preventive care and wellness, that we pay for it. And all of that's important, and everybody wants that, really, no matter what side of this question they're on. I actually think a public plan would be a very helpful part of this comprehensive health care reform proposal. And if it is paid for, and if we change the incentive structures that I talked about earlier, then I think it would be a very helpful part of the overall package, and it will increase choice for people in our country. But we shouldn't kid ourselves either, because if we have a public plan, but we don't deal with these incentive issues, then that's not going to make health care affordable for anybody. It's not going to make, the public plan isn't going to be any more affordable than the private plans, and we also run the very serious risk of borrowing more money from our kids and our grandkids because we are unwilling to pay for it. I think it's very within our policy-making abilities as a country and as a Congress to deliver, as part of the reform package, a public plan that is paid for and that provides choice, welcome choice, for people all over the country and here in Colorado.
So here are our commitments. We are absolutely committed to do whatever we can to ensure the passage of comprehensive health care reform this year. And specifically, if you champion a strong health care reform bill, we want you to know that you can count on us and call on us to back you up every step of the way.
Thank you. I want to tell you, I want to thank all of you again for being here. I want to thank Mark for, as usual, the incredible turnout tonight. You know, a lot of us work together on school reform, and I know what you just said are not empty words, because we were partners day after day, month after month, together working to make sure that we provided the kind of opportunity we need. We're only at the starting line, but we're at the starting line. The kind of opportunity we need for the children in this city and in this state, and the same is true for healthcare. This is about opportunity. You know, that's the important question. That's the important thing here. This isn't a giveaway. This isn't welfare that we're talking about. Just like we're talking about public education, healthcare needs to be assured in order for people to be able to live a predictable and successful life. And we need to figure out how to do it in a fiscally responsible way. We will. But I can't tell you how important your voices are going to be in this debate. This is not going to be easy to do. And we need your support, by the way, both from Democrats and from Independents and from Republicans. This is not a partisan issue.
Folks, I know it's been a long evening and will just be a couple more moments. One thing I want to let you know is please fill out your sheet. You heard the Senator talk about how important it is that you tell your healthcare story, and please leave it in the translation boxes.